The broadcast is now starting. All attendees are in listen-only mode.
Thank you for joining us today for a webinar from MTM Services entitled Flying the CCBHC Airplane While Building It, a conversation about leadership and learning with the CCBHC CEO. That's a little bit of a mouthful. I'm Amanda Deaver and I'll be your moderator today. Just a couple of housekeeping items. Today's event's being recorded and everyone is in listen mode, and hopefully your cameras are also off, but if not, please go ahead and turn those off so we don't get the system kind of bogged down with too much. We will do question and answers at the end. Feel free to put them in the chat box during the presentation and then we'll come to them at the end. We also have some questions that people submitted in advance and we are planning to address some of those. The video and the slides will be sent to you and all registrants after, probably within about 2 days after the webinar, and will go on the MTM website. So if you don't have to take notes, you'll get access to everything. So we're fortunate today to have two speakers with us who have deep expertise in all things CCBHC. We have Dr. Candace Hodgkins, who is the CEO of Gateway, a CCBHC in Jacksonville, Florida, and Michael Flora from MTM Services, Senior Operations and Management Consultant and a Senior Consultant to the National Council for Mental Wellbeing. Let me turn it over to Candace and Michael. And how about to begin with, Candace, can you give us a little background on you and on your organization?
Sure. Thank you so much for having me here today to talk about CCBHC. It's been quite an experience for us at Gateway Community Services in Jacksonville, Florida. We are a CCBHC expansion grantee and have been approved. Our attestation has been approved. So we are in the midst of transforming our organization that's been in Jacksonville since 1978. So there's been a lot of transformation over the years, but this is probably the biggest one that we've done. Michael?
Sure. I'm Michael Flora with MTM Services. I'm their Senior Operations and Management Consultant and CCBHC lead for MTM Services, as well as a Senior National Council Consultant as well. I've had the opportunity to work with Candace and her team for a couple years now, but also leading the organizations and helping the organizations adapt to the new CCBHC model. I was part of the original demonstration cohort, helping many of those states develop their CCBHC implementations as part of the original demonstration back in the day, and have had the pleasure working with many of the organizations across the country as they implement CCBHC.
Great, Michael, do you want to go ahead? I know you had some kind of basic background information to share with folks before we get into some of the Q&A. Do you want to start?
Sure, be happy to.
All right.
So let's see here. Are you able to see my screen?
Yes.
Yeah.
Okay. All right, so let's go. For some reason, Amanda, I'm trying to, for some reason, my screen is not advancing.
I don't have it either. Why don't I go see if I can pull it up, and maybe while I'm doing that, maybe you all can talk a little bit. Well, we can do one of two things. Michael, you can talk about some of the content you were going to cover without the slides. Do you want to sort of go through some of that, or do you want to get into some of our Q&A? Going to wing it a little. This goes to the building it while flying.
Absolutely. I think one of the things to think about is the National Council, right now there are 431 CCBHCs across the country. And that includes the original demonstration providers. The other thing we've noticed is that right now MTM Services has had the opportunity to work with over 34 providers in 34 states. That includes the demonstration states as well as the CCBHC expansion states. So one of the things that we've had the opportunity to really look at is what does it take to really get the teams ready? So this requires substantial change from the provider's point of view to really look at the core concepts, the core competencies that are going to be needed in the new healthcare environment. And so some of the things that we're looking for as a CCBHC is our ability as providers to meet those core competencies. So access is one, board governance is another, financial management, quality assurance, staffing development, continued quality improvement. All of these are areas of core competencies that we need to embrace and lean into with the CCBHC. Having our ability to manage those, and all those really teams kind of centered around those core competencies of outcomes. Can we demonstrate that individuals are actually getting better? Can we demonstrate that individuals are actually getting better? Not just the quality metrics within CCBHC, but I think also our component of making sure that of those components of CCBHC, of outreach and engagement, strategic business planning. And so is your organization, do you have the ability to provide services in a non-four walls environment? Not just meeting the CCBHC requirements, but also moving beyond those requirements. So part of that expectation, and Candace will talk about this in a few moments, we're really looking at access. I mean, CCBHC says we've got to have folks in within 10 days. We're asking you to exceed that expectation. And many of the CCBHCs that we've worked with have implemented that, beyond that, to actually implement same-day access. Implementing your NOMs and your IPP report planning, developing your attestation document with the teams, and our ability to meet all the 6 required elements in a change management strategy. So I think we're ready for our first question.
Great. Well, so I think, one of the things that people may not totally appreciate about becoming a CCBHC is that it really is a change in mindset. And I've heard you both talk about, there have been some misunderstandings that you've had to grapple with and overcome along the way. And maybe that would be a good place to begin, is sort of thinking about what is the mindset. Candace, maybe you can kick us off. Where were you at the beginning of the process, and how did your mindset have to shift as you became a CCBHC? And what do you think people who are in the application process would benefit from knowing about your experience?
Yes, I'd love to talk about that. And I think for us, when we applied for the CCBHC, it was right before the pandemic. We did not get it, and I said phew, because we were dealing with all sorts of change due to the pandemic. And then in the midnight hours of February of 2021, we got awarded the grant. So we just had to hit the ground running. And I think the biggest thing for us was trying to articulate to my staff what this was, because I wasn't really sure what it was either. We've had lots of SAMHSA grants over the years. They always end up being a program that helps us kind of enhance our services or excel the things that we do, because we have money now to do it. But this was totally different. And so I had to understand, I had to be able to articulate to staff that this is not a program. This is not a program. This is a transformational process. Even though it's for outpatient services and we have residential and detox, but it's still a transformational process for the whole organization. And that probably was the hardest thing to do in the beginning. And of course, having MTM on board with us to have lots of different meetings to figure out what we were doing, because also we had 4 months to get the attestation done, which was a huge lift in the midst of doing everything else, all we do to make an organization run in the state of Florida. So knowing that at the get-go would have been helpful for me, but I felt like I was at a disadvantage. So I'm excited that we're having this webinar, because I have lots of colleagues that are going to go for this next grant round, and people across the United States that are going to go for it. And it's helpful to understand what it really means at the start, because that just puts you a step ahead of everything. Also access. So we did a gap analysis and we looked at, what our time from first touch to when somebody would get into treatment for outpatient, and it was a abysmal 66 days. I mean, I was horrified when I found that out. And I knew it was a long time, but I didn't know it was 66 days. And so we worked, and now we have same day access. And now that took months to get going and to do it appropriately. And it was like the fourth time I had attempted to get it going in our organization, and found out that it's better to have somebody guiding you through the process than trying to do it on your own. And now, you know, we are, because it's 10 days, 10 business days that you have to get from first touch to somebody through the assessment. We're there, they come in and they have an assessment in one day, and then they can come in the next day and have a service. So we are exceeding the 10-day. I think we're at 4.5 on average right now. And so to me, that's a miracle, from 66 to 4.5, and it took 7 good months to get it going, but it's going. So these are the things you have to think about when you are looking at, okay, what am I going to do? What do I need to understand? And that just helps that, you know, we're now an integrated, person-centered, and I get to say we passed our attestation and was approved. So we are fully up and running as a CCBHC, and that means integrated, person-centered processes. And it doesn't mean that we have to do everything ourselves, because that can't happen in my community, because there's lots of different providers that provide safety net programs. So we all collaborate together, and so that's something else. Every community is different, so you have to figure out what your community needs, where the gaps are, what your organization needs and what the gaps are, and then fit it all together.
I think one of the things that Candace brings up is that level of attestation. So things that have to go into place there are really thinking of rethinking your policy, your procedures, your workflows, your training, your competency plans. Many organizations that we work with at MTM Services, when I'm doing this work and getting them prepared for their attestation, is that they may say, well, we do that, but it's not hardwired into the organization. It's not a policy or procedure, or it may be a procedure, but we've not updated it for a while. So it's really going back in and providing that level of attestation, or what SAMHSA calls evidence. What is the evidence that you meet these expectations? What specifically are you doing as a provider organization that meets this needs assessment, that meets this staffing plan, that shows services to veterans, that shows the access to care within 10 days or exceeds that first touch with an assessment? And as Candace said, she's tried this before within her organization by going to the National Council conferences and saying, okay, we heard Joy or Scott or Michael talk about same-day access. We think we can do that. And it's kind of one of the things that we say at the National Council conferences, don't try this at home, is that you really truly need to walk with us for that fidelity to the model. Would you agree, Candace?
Candace is not on the screen right now. I don't know if she got disconnected.
Okay. Well, let's kind of move on then to our next question, which is around leadership.
Yeah, Michael, why don't you take that one and we'll get Candace back on, but this is a big one.
So when you think about leadership in CCBHC, what kind of leadership is required to thrive? You know, what are the necessary priorities that we need? So we have to embrace the vision as senior leaders and articulate this to the team. You know, be that agent of change. One of the things that I found over the years in working with MTM is that if senior leaders aren't in the room for these transformational changes, it's likely that the changes will not solidify, because management has chased the next shiny thing or moved on. And so this does require a level of commitment from the CEO to senior leaders to make this happen within your organization. So actually be involved in the process, as there will be some level of resistance from staff, you know, but don't give up. Because remember, we are providing transformational change. You are no longer a community mental health center. You are no longer that family guidance center. You're no longer that arm of county government. You are a new provider type. So really be able to find someone to kind of help guide you. And that's what we do at MTM Services. We're there with you. We're providing alongside you. But also with this process is that we also provide you in our phase 2 implementation is we provide you with a toolkit to say, okay, this is how we meet non-4 walls. These are some samples in competencies around cultural and linguistic competencies, or staffing plans, training plans, policies, procedures that you might think about. What's the crosswalk between your current accreditation and the CCBHC? And establishing those priorities over time. So we actually develop a plan, do, study, act model with you to implement, because CCBHC is not just a SAMHSA grant. It's a process that needs invested. So one of the things I tell teams is to really think of CCBHC as a payer, not a program. And as Candace said earlier in the previous conversation, is that traditionally we may have seen this as I've had SAMHSA grants before, so it's a program. This is what we do, and it's siloed over here. This permeates all aspects of the organization. This touches outpatient. So there are those required services as a CCBHC. So think about this as setting this up in your system as a payer or a waterfall in your business system. Now, there are going to be those services that you aren't able to bill for, and that's where the grant can support but doesn't supplant current funding. So if I'm seeing a Medicaid recipient, I'm going to bill Medicaid for all those services. But there may be a service that isn't covered by the current service definition in your state for Medicaid, and that's where the CCBHC funds come into play. Or I may need to hire more staff, or I need to increase compensation. I need to build the infrastructure that I needed. And so winning the grant is not just enough. You need to operationalize those expectations, leading the change and developing those champions within the organization to drive those deliverables. So part of our process is we do a readiness assessment, phase 1 scope of work with teams, where we look at the assessment itself, the gap analysis that Candace was talking about. We look at your costing model. We look at your electronic health record, operability and functionality, data mapping, and then we move to implementation, where we will probably implement all of the aspects of CCBHC to operationalize and get you ready to see your first client within now a year, where Candace had 4 months to get up and running. Candace wishes she would have had a year to do that. But really looking at ways to operationalize this within your organization.
Candace, I think you're on mute. No. We're still not hearing you. Nope, Candace, you've maybe. Why don't we do this? I know Candace has some really important observations and recommendations on the leadership front as the CEO, and we can come back to those. But Michael, maybe while Candace is working on her audio, do you want to talk a little bit about some of the funding and billing challenges and opportunities for CCBHCs? Sure.
I think, really thinking about, as we said, this is a payer, not necessarily a program. So you may already have other grants or other funding. So it really depends on the organization. Mostly insurance, Medicaid, or higher, in state funding create different issues. So depending on what's going on. So you will need to set up sort of that infrastructure, that billing. Remember that the grant funds support, they do not supplant what you're doing. So each community is set up differently. So don't be fearful if you don't provide all the services listed. Rely on your community partners that do provide those. So bring those in as DCOs or designated collaborating organizations, or even memorandums of understanding. I think Candace had a very unique approach in bringing in or expanding mental health services within her organization. She was able to bring in one of the local, mental health partners and have them supply additional staff to help support the mental health services. Now, she was always providing mental health and SUD services, but on a limited basis. So really looking at the capacity to build that. Learning the cost per individual. I think one of the things that Scott Lloyd does very well within the CCBHC and other work within MTM services is really drilling down on your actual cost by CPT, HCPC, and provider type. And if you had the pleasure of seeing Scott at the National NACON conference a few weeks ago, he was able to talk a lot about the costing model. And the new tools actually help drive some of that prospective payments. So really looking at, taking that deep dive into looking at what our current costs are by CPT, HCPC, provider type, by program, because we have to be able to develop that infrastructure for that prospective payment rate. And also think about that sustainability and advocacy component. Work with your local state association, your local Department of Mental Health, Behavioral Health Care, SUD, other advocates to help support and sustain CCBHC. And really, we applaud SAMHSA for promoting and funding, that person-centered care that lives in the CCBHC model. And we're all learning to do this together as this becomes that new provider type. But the beauty of the prospective payment and the model itself, the primary goals are to improve access and demonstrate outcomes. How can we really look at the unique needs of our communities? What are the unmet needs in our communities? How would these funds help you? So every grant tells a story. And you all have a great story to tell. So really thinking from that needs assessment. So I always like to look at it as that, the golden thread. Everything starts with the assessment, right? Even when we do the collaborative documentation training, we really talk about the golden thread. And so the assessment starts everything. Everything starts with that assessment, which looks at the needs assessment of your community, the prevalence, the incidence data. What are the unmet needs, the medically underserved areas in your community, the health professional shortage areas, the demographics of your community, the census data of your community, the behavioral risk surveillance data. How does that all drive the need in your community? The need then will drive the goals and objectives of your narrative, of your CCBHC grant application. The goals and objectives to meet the need in the needs assessment will drive your interventions. What evidence